Good afternoon, everyone, and welcome to the November edition of the HTSA Research Webinar Series. This is George Yorling, Director of Medical and Scientific Affairs at HTSA. And today I'm pleased to have both Dr. Sam Frank and Dr. Claudia Testa here to give us a brief overview of an upcoming trial called FIRST-HD. Before I do that, I just want to remind everyone, if you're new to the Research Webinar Series, that this is intended to be interactive, so you can ask questions at any time during this presentation by just going to the menu box on the right-hand side of the GoToWebinar and type your question in the red box and click Send. And at the end of the Dr. Frank and Dr. Testa's seminar, we will be asking the questions on your behalf. Just as another reminder, just in case you have loved ones or family members that are unable to view this at this time, we're recording this webinar, and it will be on our website within a week for viewing at your convenience. And finally, just want to give everyone an update on the upcoming schedule. Because of the holidays and everyone's travel schedules, we have decided to forego a webinar in December, so we look forward to seeing everyone in 2014. And in January, I actually will kick us off with a year in review for HD research, both at HDSA and in the world. And then in February, tentatively scheduled for the 19th, we have Dr. Albert Seymour, who's the Vice President and Head of Discovery Research at Shire Pharmaceuticals, where he will be presenting an update on the Sangamo technology to zinc finger proteases as a tool to lower Huntington. And as always, if you have any ideas for topics that you would like to see covered on the Research Webinar Series, please email them to us at researchupdates@hdsa.org. So without further ado, I'd like to introduce Drs. Frank and Dr. Testa. They will be, Dr. Frank is an associate professor at Boston University School of Medicine, and he is also a member of our HTSA Board of Trustees. And the PI, they're both co-PIs of this upcoming FIRST-HD trial. Dr. Testa is MD, PhD from the University of Michigan and is Associate Professor of Neurology as well as Director of the HD program at the Virginia Commonwealth University Medical Center. So without further ado, I'll turn it over to Dr. Frank.
Thank you, George, and thank you for having both me and Claudia on to talk about FIRST-HD today. It's a really exciting trial, and it's an opportunity to participate in research, and as you can see from the Huntington Study Group logo, we always seek treatments that make a difference. So we hope to improve on what's already out there and move forward in terms of the realm of clinical trials as well. So today we're going to be talking about first-time use of SD809ER in Huntington's disease, or the acronym FIRST-HD. We're going to spend, we just have a few slides to go through just as an overview of the medication. It's the study drug as well as the trial overall, and we hope to take your questions after that. In terms of an overview of SD809ER, it is an investigational drug, so it's not approved by the FDA yet, and it has the same action as tetrabenazine, which many of you may know is a drug that's currently approved in the United States and Canada for the treatment of chorea. Tetrabenazine is used for more than just Huntington's disease, so it has appeal to the broader movement disorder community, and in other countries it's also approved for tics associated with Tourette syndrome and tardive dyskinesia, which are movements often of the mouth or tongue or limbs that look similar to Huntington's disease but are induced by medications. Tetrabenazine is, the trade names in the United States is Xenazine, and in Canada is Nidamin, and so you may recognize the medication as those names. So what's the appeal for SD809ER? One of the main reasons that we're studying this is that it increases how long the drug stays in your system, and this is termed the half-life. And so this longer half-life reduces the fluctuations of the ups and downs when you take a medication, and so there's a more even level of so this also reduces how often you have to take the drug. So if you have to take a medication, at least in this trial, the study drug is twice a day, but let's say you could get away with it even once a day, that could be much more useful for you and easier to take than 2, 3, 4 times a day, which sometimes some medications have to take. Now, this is not the first time it's been exposed to humans, but it is the first trial in Huntington's disease. And Auspex Pharmaceuticals, they're the study sponsor, working with Huntington Study Group, have completed studies comparing blood levels of S-acetylcholine to tetrabenazine in healthy volunteers. So there have been a number of people that have been exposed to this medication, and it does have the same, or I should say a similar mechanism of action as tetrabenazine. The total amount of study drug delivered is similar with S-809, but the maximum level is lower and the action is smoother. So what we hope this means is that you're able to reduce chorea and with less frequent dosing and hopefully with fewer side effects as well. So just an overview of the trial itself. Who is eligible to participate in FIRST HD? And we're looking for approximately 8 individuals. And George had said that this is an upcoming trial. This is actually ongoing now. We have over 20 sites that are up and running across the U.S. and Canada, more to come. But we're looking for 90 individuals aged 18 or older, or the age of majority, whichever is older in your state or province, and who have been diagnosed with Huntington's disease. Since we're looking at chorea, patients that are eligible have to have chorea and who have never taken tetrabenazine. What is it that we're doing? What is it that we're studying? We're randomizing, meaning a flip of a coin, every person to S-acetylcholine or placebo, which is a 50% chance of either. And the starting dose milligrams per day, increasing to a maximum of 24 milligrams twice daily. So this says second quarter 2013, and this study is well underway. We have a number of people that have already enrolled and a number of sites across the U.S. and Canada that are up and running. And so participants who complete the study and who are tolerating it may be eligible to participate in a long-term open label study. So there's a 1-year extension beyond this where everybody gets S-acetylcholine for their chorea, and that's the ARC-HD trial, which I know that there's some information out there about that trial as well. So as I've said, this is going to be approximately 30 sites across Canada and U.S., and we'll show a map a little later of where that is. And why is it that we're doing this study? What is it that we're looking at? We're looking to evaluate the efficacy of S-acetylcholine to reduce the chorea associated with Huntington's disease, as well as evaluating the safety and tolerability of titration and maintenance therapy with S-acetylcholine. Now, that being said, we're also setting a lot of ground rules for the FDA in terms of moving forward with clinical trials for Huntington's disease. So this isn't just looking at another medication. We're doing a lot of innovative testing of different aspects of clinical trials related to Huntington's disease. And what does it entail? And the how, it's at least 8 in-person visits and 7 telephone visits over about 4 months. In terms of qualifying for FIRST HD, if you are a patient who's, as I've said, diagnosed with Huntington's disease and has chorea as a feature, since that's what we're addressing, that's a good start. No previous tetrabenazine use, and you have to be 18 years old or reach the age of majority. Subjects have to have a caregiver who can come with them to research visits, and this is for multiple reasons, only one of which was mandated by the FDA, in fact. There's a special coating to allow slower absorption, and so that's why the tablets need to be swallowed whole, and no current or previous suicidal behaviors. Certain medications are restricted so that we can look at the impact of S-acetylcholine, and the study staff will review these with potential participants. So some of the more commonly used medications out in the community include quetiapine, which is the brand name Seroquel, citalopram, which is the brand name Celexa, olanzapine, which is the brand name Zyprexa, aripiprazole, which is the brand name Abilify, and risperidone, which is the brand name Risperdal, are excluded at this time. Some other qualifications, willingness for women of childbearing potential to use adequate birth control. We're monitoring walking as part of this trial to see if that changes, and so you have to be able to walk 20 yards. No serious or unstable medical illnesses, and there are some labs that are done as well as an ECG measuring the electrical activity of the heart. No alcohol or substance abuse within the last 12 months, and no illicit drug use at the time of the study. This is a list of participating sites. Not all are up and running, but as I said, about 20 are at this point. So you can see that we've covered the United States pretty well. And if there's a site that's not near you, please get in touch and see if there's something that we can do to get you to that site to see if you're interested. And this is a better way of looking at the different sites, and you can see it's spread across the entire United States. The one site that didn't make it on there is UCLA in the Southwest. But other than that, you can see that we've covered most of the United States and across Canada pretty well.
And Sam, can I go back just a little bit?
Sure.
It's always worth talking to one of the sites because there are always nuances in the criteria that Sam just went over. For example, you do have to be able to walk, but you can walk with an assist device. Or we're working on, are there some medications that are currently excluded that we could safely amend the protocol to find a way to include people on this medication. So things, there's always details, and if you are thinking, I wonder if this is an okay fit, but I heard that maybe this isn't going to work out because of the medication I'm on or some of my symptoms, it's always worth checking in with one of the sites because they want to do what's a good fit for a potential research participant and do something that works, and they can go over more of the nitty-gritty details and see what's right.
Right, that's true, and there's always changes to see what we can do to include more people. We started off with the absolute safest, and once we're confident that we have still a very safe trial to do, we can make small changes, and those are likely to be instituted over the next few weeks. So do check back if you're on some of the medications that have been listed. It's possible that if you've been off of them or if even the one medication that we're looking at specifically is citalopram. There are others as well, but that may be permitted. It still needs to go through all the ethics review, and so it's pending, but it's being discussed.
And then the other thing is just looking at the map. I know some of the interested people I've talked to that I talked to at Huntington Study Group said when they looked at the map, they saw places that might be within striking distance of a really long drive or a short airplane ride, and they weren't really sure if they could handle that level of expense or level of travel. It's always worth talking to the sites to see how our study could help make it safe and feasible for someone who's a good fit to participate, so that you're not taking on extra cost burden for travel. We may be able to help people out or figure out how to make things more possible. It's always worth the discussion. If you're looking at the map and saying, geez, this sounded good for me, but I'm in one of those spots that look a long way away from one of the red dots, we can try to help figure things out on an individual basis.
Right, so if there's a site that's within striking distance for you, so to speak, then please feel free to reach out to that site and say, you know, I'm X number of hours away. Is there something that we can do to help get me to the site? And you know, I mentioned the 1-year extension afterward, ARC-HD. So again, that's an open label trial of using SD809 is done. So after the 4 months of participation in FIRST is completed, if you've successfully completed that, then there is an open label extension. That being said, there's also a very small arm at some of the sites, not all of the sites, where we're looking for people that are on stable doses of tetrabenazine that would consider participating in the study, again, in an open label fashion and testing out SD809ER. So do take a look at some of the links that are available through Huntington Study Group, through Auspex, through clinicaltrials.gov, and find out about FIRST as well as ARC to see if you qualify for either of those studies if you're interested. And I think that's all we had just as an introduction for this drug and this trial. I think that we wanted to leave some time for questions, and to see if what the interest level was on the folks that were listening to this webinar.
Great, thank you, Sam, and thank you, Claudia. So if there are any audience members that do have questions, please feel free to type them in now. And while you're doing so, I guess I'll go ahead and get us started in terms of, I'm just thinking, for this phase 3 trial of 90 patients, Sam, as if all goes well and it is safe and appears tolerable to HD patients, what trial's next? What's next for Auspex and HSG for SD809?
So what's next for Auspex and Huntington's disease, I'm not sure. We haven't talked beyond the 1-year extension after FIRST HD is completed. So there are almost always other studies that are done in people who don't necessarily fit criteria or have different criteria that we're looking to test a next generation medication. So I'm sure that there will be other trials in Huntington's disease. In the meantime, this medication may have use in other conditions. And so Huntington's disease is a great model sometimes to spring toward other diseases. So for example, we understand a lot about Parkinson's or Alzheimer's because of studying Huntington's disease. So that can be true for treatments as well. And I know that it's on their radar screen to consider treatments for Tourette's syndrome and for tardive dyskinesia. So that may be the next step beyond Huntington's disease.
So George, I think what you may be asking is, do we have to wait through another 2 or 3 years of trials, or would this come out for broader use in Huntington's disease, right? So
yeah,
this is considered...
Will another phase 3 clinical trial be required for...
We're hoping not. This is designed to be the pivotal study. So if it works, which we don't know if it'll work, otherwise we wouldn't have to go through testing it. Hopefully, if it does appear both safe and effective with the number of people we get to sign up for FIRST HD, we get really solid data out of FIRST HD, then this can be used as the pivotal study for the IND to then move the drug towards market, towards chorea and Huntington's disease approved use.
Okay.
And there's a lot of ifs, right, because you got to get through the FIRST HD study and analyze the data. But in theory, if it was a solid study, then it's the pivotal trial, is my understanding.
Yep, that's right. And they were able to get their foot in the door and go directly to a phase 3 trial, essentially, because of the preliminary safety data in humans and because of the mechanism of action, how it's similar to tetrabenazine. So
another thing, Sam, that really helped them with their application for this to be the pivotal trial, even though it's the first big test within Huntington's disease, is, as you mentioned earlier, there are a lot of innovative measures where, of course, we're looking at chorea because the idea is that this helps with chorea, but we're also looking at potential quality of life measures, asking research subjects for their general impression about how they feel, and trying to find new ways to figure out if making an impact on someone's chorea is doing something positive for them.
Right, as well as some other measures like balance and other tasks. And I think one of the other innovative aspects of this trial, which I think is going to benefit the entire HD community, is the idea of assessing understanding of participating in clinical trials. So every person that is a potential volunteer for this is going to have an evaluation of their memory, essentially, memory and thinking, and that has not been done in a systematic way in the past in terms of clinical trials, which will hopefully pave the way for the FDA to have less fear about Huntington's disease and move forward with other trials.
Yeah, we're hoping that this shows the FDA that their people can, with Huntington's disease, can understand their participation in research and ethically be active participants in clinical trials and really take down some of the barriers towards getting clinical trials started in disorders like Huntington's disease.
And the other really innovative aspect, I think, of this trial is that, as some people may know, if you go above 50 milligrams a day of tetrabenazine, it's recommended that the CYP2D6 testing, basically there's an enzyme in how to metabolize tetrabenazine, is broken down. That genetic testing of whether people are fast metabolizers or poor metabolizers of the drug, that evaluation has never been done in a systematic way, really. Baylor has done some preliminary work looking at the use of that genetic testing, but it was put in place for tetrabenazine to be on the market, but that's being systematically studied as part of this trial. So that also will add to the Huntington's disease bank of knowledge.
So every participant will be genotyped for the 2A6?
Yes.
Okay.
Yes, but we're keeping it blinded. So the hope is that we'll have that data for safety and that we've designed it that it doesn't matter if you're a poor metabolizer or a fast metabolizer, you're still going to be titrated in a safe and hopefully effective way on the study drug. And then we'll be able to do an analysis after the study's closed using that blinded data and figure out whether going forward people really have to have that testing done, or if we could get rid of that barrier and not need that genotyping done for people. So everyone will get their genotyping for the CYP2D6 enzyme for fast metabolizer or slow metabolizer done. We're going to keep it blinded.
Okay. So kind of goes along the lines of the different appointments that a participant in First HD or ARC-HD would have to have. You mentioned that there are 8 visits over 4 months as well as 7 telephone, I believe, 7 telephone visits.
Yep.
Can you guys expand on what the families and patients should expect from those appointments? Are they, what kind of time is going to be required? What type of procedures might they be subjected to?
Sure. So for the first couple, they're a little bit longer, and they may take up to a few hours to do because there needs to be an assessment of their ability to sign the informed consent form, as well as monitoring their Huntington's disease, a general physical and neurological examination, having blood drawn, and we're also videotaping, I should say video recording all the participants in this trial, so that we can take those blinded, those videos have no identifying information, but somebody who's not affiliated with the trial is going to take a look at chorea and score it. So all of, as well as all the pencil and paper tests and tests of balance and coordination and walking. So it can take a few hours for the first couple of visits. And the visits after that are a bit shorter, only because there's less to go through, finding out about any possible side effects that you may be experiencing, changes in your health, other medications that may have been started or stopped, as well as a brief neurological examination, specifically of chorea and Huntington's disease specific. And then the last couple, as we finish out, are also a little bit longer. There's, again, videotaping, at the end of the study when participants are on medication to see what the difference is.
The videotapes are less than 10 minutes long, and it's a way to record someone's chorea. If you just look at someone's score sheet, maybe the score sheet got mixed up, or maybe, God forbid, it got lost. How the person actually looks gives us an opportunity to let blinded raters score the chorea separately and to really get a handle on whether we're making an impact on the chorea. But the videotape itself is quite short and is only a part of the day for some of the visits. As Sam said, the beginning visits are always longer because there's a lot of safety and a lot of information up front. Make sure that the site has all the person's medical information. You do a bigger exam than usual to make sure that they're safe, don't have any big things going on medically that might run them into trouble participating in a study. And then the middle visits are a lot shorter because you've got all that stuff under your belt. The only invasive thing is the blood draw.
Okay.
There's no other needles involved. There's no lumbar punctures.
Although that being said, lumbar punctures aren't that invasive. So.
It's true. The only thing involves needle is the blood draw, and then aside from parts of a neurological exam that people are used to, and a general medical exam like listening to the heart and lungs in the very beginning for safety, there are those ECGs or EKGs people may have had done before, where they put the sticky leads on the chest and take a recording of the heart's activity. I know from working with Huntington's disease patients and families in other trials that those are doable, but can be stressful for people with a lot of chorea because they wiggle around. So the sites know this and are prepared to be patient and calm with the EKGs, and we've tried to limit them as much as possible.
Great. And another question is, in terms of if all goes well, what are the timeline goals for First HD in terms of last patient that you hope to have enrolled, and when you may expect the data to be reported?
So we were hoping to get the trial enrolled by the end of the calendar year. We got held up a little earlier on, so it'll probably be another month after that. So, but certainly by January we want to have everything wrapped up. And so 4 months after that puts us into May in terms of closing up all the forms and getting the data entered. And then it takes a bit of time to make sure that all the data is put in the way it was supposed to put in and answer any last-minute questions. And then we do an analysis after that. So I would imagine that it's going to be fall of 2014 that we hear some significant news about it.
Okay, great. I think at the moment that's all we have. I will remind all of the viewers that in addition to the websites you see here, as always, you can go to hdsa.org and click on the Clinical Trials tab, and there are links provided both to HSG, clinicaltrials.gov, and as well as the contact information for all of the site coordinators and active sites for First HD and ARC-HD. So if you are interested in participating, I encourage you all to think about it and reach out to a coordinator near you. And as always, if you have any questions about First HD, don't hesitate to email us here at HDSA, and we will be happy to try to get the answers for you.
So I just wanted to thank everyone for their time and attention as well, and it's really important for the HD community to think about and participate in research in general, and this is no exception. As we've talked about, there's a lot of innovative aspects of this trial that make it interesting, and we really need to move forward with getting next generation treatments for our patients and families.
I'm really excited that we've got a new small up-and-coming pharma company directly interested in Huntington's disease, and pulling in yet another group on the pharmaceutical side to help out developing treatments and hopefully cures in the future. It's exciting to see another player join the interest in Huntington's disease.
Absolutely. Well, great. Thank you very much, Claudia, and thank you very much, Sam, for enlightening us about First HD. And as I said, this will all be on the website within a week. And thank you for joining us.
Thank you.
Bye-bye.